single day, like I've always done and always will.
Passing these bills on the floor, making yet another stand.
Welcome to this week's edition of New York Now. I'm Chantal Destra. Governor Kathy Hochul and legislative leaders are still actively negotiating the state's budget, now 3 weeks late. Today, we'll be diving into one of the more controversial proposals that has been stalling negotiations, and that is auto insurance. In her executive budget, Governor Kathy Hochul proposed a series of measures that she says will drive down the cost of auto insurance for New Yorkers and crack down on fraud. Meanwhile, critics of the governor's plan, including the New York State Trial Lawyers Association, argue that the plan actually does nothing to drive down the cost of premiums and will instead financially help insurance companies. The executive and legislative chambers have not quite figured out how to address the issues with the proposal and come to an actual agreement. To understand the controversy around the auto insurance proposals at the state capitol, we are joined by Austin Jefferson of Streetsblog NYC. Now, what can you tell us about Governor Kathy Hochul's auto insurance proposal? Can you sort of give us the lay of the land on this issue? And why is it so important for the governor this year?
So, in broad strokes, she's trying to lower insurance costs by reducing large payouts from insurers and then also attacking fraud.
Right.
She believes both of these issues are increasing costs for insurers, and that cost is showing up in high costs for policyholders. But the way she's doing it is drawing a bit of concern from lawmakers and the public. Mm-hmm. She wants to alter the serious injury definition within insurance law, which basically it's lists a bunch of major injuries and losses of limbs and stuff like that would entitle someone to seeking further compensation after a crash. But she's dropping one section that's referred to as the 9180 law that essentially says if you are unable to resume your normal life after a crash for 90 of the 180 days following a crash, you're entitled to seek extra damages.
Wow.
She's also looking to make it so that if you are 51% responsible for a crash, you can't seek any damages as well, which a lot of people view that as kind of unfair if there's a situation where, say, someone was jaywalking and then you're hit by a car. Also, if you are uninsured or committing a crime, she wants to make sure those people can't seek damages as well. But at the same time, if you are borrowing a friend's car, technically you're uninsured while operating that vehicle. So if you're hit by someone, you don't really have any recourse. Right. And there's also a tweak that right now in insurance law, if there's a crash with multiple parties, it's called joint and several liability, where everyone kind of chips in based on their share of responsibility in the crash for damages. But in the event that a party that's mostly responsible doesn't have either enough coverage or just money to pay out the award, someone who's less than 50% responsible could be liable for paying that out in full in some cases. And I think the concern there was that public fleets like the MTA and stuff like that could be on the hook for millions after a crash. But the point of that law is to make sure that a victim gets all their money after a crash.
The New York State Trial Lawyers Association has been pretty vocal in their opposition to this plan by the governor. Can you explain their positioning on this and some of the messaging that they've been putting out?
Their feeling is that, trial lawyers, in their opinion, don't necessarily want to take on cases that don't have a good, outlook to either win or seek damages. And these changes to the insurance law, they say, are going to make it so that they don't really have any, incentive to take on risky cases like this anymore, which leaves victims in a bad place. And I guess if we're being fair to their businesses, it's hard for them to make a profit if there's no sort of hope of these cases to go anywhere. And I think some of them have even pointed out that these cases weren't even slam dunks in the first place. A lot of the cases, it takes years to prove that someone was seriously injured in a way that doesn't show up within the strict definitions of the current law. That 9180 rule. It could take tons of neurology visits, things like that, to say that someone actually had their life altered. They're very concerned that this is going to be a sort of legal minefield going forward if it actually passes.
And given that opposition, how has Governor Kathy Hochul been trying to ramp up support for her proposal both at the Capitol and around the state?
Well, she's made this her top issue this year. So, I mean, she's been essentially campaigning for it,
Right.
going all over upstate New York, from Buffalo to Albany, visiting, small businesses and, repair shops, and even, law enforcement, just to sort of show that, like, there's broad support for this issue from different parts of New York, even Long Island, the city. And I mean, I think in the Capitol, she's kind of been making the point that, this is going to save New Yorkers money. And if your lawmakers didn't support this, that's a problem for you, because your constituents can sort of say you didn't care about my wallet. But on the other side of that, I mean, you have lawmakers who are saying, I have to go home and explain this to people.
Right.
And there's real concerns that this won't even lower rates. And on top of that, it'll leave crash victims in a not great place. So, I mean, I think if you're if you're picking between having to explain why you didn't reduce someone's premium and having to explain why someone couldn't, feed their family after a crash, I think one of those is a bit worse.
Yeah. And one of the interesting parts about all of this for me is the conversation around donations. The governor recently alluded to the possibility that the reason that lawmakers are against her proposal is because they are in the pocket of some of the entities that are very public in terms of criticism for that proposal, the New York State Trial Lawyers Association being one of them. So how has that rhetoric sort of contributed to the hostility around this issue?
So Hochul has been referring to the trial lawyers as a special interest for most of the year, sort of saying that special interests are sort of creating all this opposition. And I mean, the trial lawyers are a very powerful force in New York politics. I mean, they're regular donors to pretty much all of the state legislature. Their top lobbyist is a close friend of the Assembly Speaker, Carl Heastie. I mean, they definitely have roots in Albany. But at the same time, I mean, there are special interests that are backing her side of things as well. I mean, Uber's spent $8 million donating to sort of advertising and messaging around her proposal. And its CEO is one of her donors.
Yeah. And you mentioned that this is a top issue for the governor, and of course, it is an election year. So how is she hoping that this issue will essentially address her affordability agenda, but also drive New Yorkers to the polls in November?
I think that Democrats for a while now have sort of seemed asleep at the wheel on affordability. So I think something like this, where it's easy to sort of sell, just saying like, hey, I will make this one bill you have smaller, it plays very well. I mean, on the other hand, I think that perhaps when she was crafting this, it was at a time when she was expecting to have a sort of pesky primary challenger in the form of her lieutenant governor, Antonio Delgado, and then come out of that and have to face Lee Stefanik, who would have been very beatable in a Democratic state like New York, but a difficult campaign nonetheless. So having this to point to as something you've done would be very helpful. But without that there, it is kind of a lot of energy being spent to, I guess, win a perfunctory election in her case.
Yeah. Has the executive chamber sort of brought up any data or estimates as to how big of an issue this is in New York and how much, in terms of money, this would help New Yorkers from month to month?
So they've said that it would save, I believe, $300 on New Yorkers' yearly bill for insurance. We found that to be less, either $200 or even $25 by some estimates. And I think in the process too, she's been pointing to this number about fraud, where I think it was more than 40,000 cases that the State Department of Financial Services has identified. But when me and my colleagues reviewed that, we found that maybe I think it was 0.6% of those flagged cases actually turned into arrests of actual fraud. I mean, I think no one's under the impression that there's no fraud in New York, but I think in the numbers that it's being suggested it's happening, we're not seeing a connection between that and how prices are being set by insurers. And even they'll say that.
Yeah. And apart from the auto insurance proposals, what are some other big transportation issues that you're hoping the governor and legislative leaders will take up this year?
So upstate transit authorities like even the Capital District Transportation Authority, in Rochester, in Syracuse, and Buffalo, they're looking for more funding from the state to sort of just do general upkeep and even in some cases expand services, because they're, by and large, they're not on great financial footing. I think partly because of the pandemic and then also just different transportation habits in upstate New York. So they're looking for, I believe it's $75 million on top of what's already allocated in the budget this year for upstate transit funding. And I mean, the governor's been rather quiet on this issue, but I think there is hope that she'll sort of come to the table on it because it's such a small amount in the grand scheme of the $200 billion budget. There are also conversations around a free bus pilot in New York City, sort of expanding on what's already happened in the past with Zohar Mamdani, sort of bringing it back up again after he launched one as an assembly member. That one, I mean, Assembly Speaker Carl Heastie has said that they haven't even gotten to it because of how sort of intense these negotiations around car insurance have been.
Wow, very important issues. Well, unfortunately, that is all the time we have for today. Thank you so much for taking the time to speak with us today, Austin.
Of course, thanks for having me.
And we were speaking with Austin Jefferson of Streetsblog NYC. And for more on the governor's car insurance proposal, you can visit our website. That's at nynow.org. Now turning to another important topic. In last year's state budget, the state allocated about $20 million in funding to help abortion providers in the state. Now, 1 year since that budget has been passed, those providers say that they have not received their funding. In this next segment, our Elise Klein dove into the allocation issues for the funding and the state's role in the delay. Here's that story.
Last year, the state legislature and the governor signed into law a $254 billion budget, which included $25 million for abortion provider services. But to date, these dollars have not yet been distributed to providers and facilities. The funding would help support many organizations in paying their staff, keeping their facility doors open, stocking medical supplies, and more.
We have incredible protections here in New York State, in our laws, in our state constitution, affirming our right to abortion and reproductive health care. That right is a hollow promise if folks can't access it.
About $5 million of last year's funding is intended to go towards additional abortion provider services, such as abortion medication. Some Planned Parenthood facilities stress that the funding is critical for them to provide care for their patients.
That is a really important piece of money for Planned Parenthoods because we offer medication abortion as well as in-clinic service, and medication abortion is chosen by close to 75% of the people seeking abortion. We are underpaid for that service in terms of what it actually just costs us to provide it. The Medicaid coverage doesn't even come close.
The funding issue also comes at a time when Planned Parenthood facilities are facing additional obstacles. President Donald Trump administration's Big Beautiful Bill, signed into law in July 2025, put restrictions and bans on Planned Parenthood funding access via Medicaid reimbursement. Robin Chappell-Golston, president and CEO of Planned Parenthood Empire State Acts, says this extra pressure makes state dollars essential and timely allocation of funds even more important.
Obviously this money had good intentions and is to support providers to make sure that everyone can get care. So when they make that commitment to provide that funding, but then we don't actually get it, it doesn't have the impact that its purpose is for.
Chappell-Golston also highlighted the organizations in conversation with state lawmakers and leaders about the delay in the allocation of funding.
That these are taxpayer dollars, that you want to make sure that there's due diligence and, accountability for those funds. But at the same time, when it's not getting to the entities that need it, it just makes the pain worse. And also, when you're trying to help someone and not kind of following through, it does have ramifications.
The ramifications for many facilities means they have to struggle to budget while they wait for funds they were promised nearly a year ago.
We do all the things that individuals in households with low income or who are waiting for particular pots of money do, right? We decide what bills to pay when. We make hard decisions.
The New York State Department of Health last month in March sent out letters to 22 potential awardees of the $20 million in state dollars from last year's budget. Joanne Moore, the State Department of Health Deputy Commissioner, says procurement of state funds can take time, ranging from a few months to over a year. Moore stresses the Department of Health feels they have followed the procurement laws of the state, saying they don't look at the timeline of releasing these funds as a delay.
I wouldn't necessarily suggest that there's been delays. I think it's what talked about it's a full process. So there is a amount of time that it takes in order for you money to come to the department for the that process to happen, for awards to or awardees to be selected, and then for the communication and the affirmation of acceptance of that award. So it's the process, which which takes time, but I don't consider it to be delayed.
The deputy commissioner says the health department is still processing the $5 million allocation along with the $20 million allocation. The state budget was passed and signed into law at the beginning of May last year. The communication letters from the Department of Health for the $20 million allocation were sent to awardees in March, which is about 10 months after the budget was made law. The Department of Health told WMHT all 22 awardees accepted the eligibility funding letters and are working to develop their budget for the 2-year contracts, which will begin July 1st. State Budget Director Blake Washington says from his purview, there were some administrative issues that seem to have held up the procurement process.
I think the biggest hangup, there were a lot of, there were some methodological changes on how we can actually allocate the money to some of the providers, and that kind of hung up the department. And that sounds pejorative, but that's not what I meant. I think just working through that is just heavy. At the same time, we're doing any number of other stuff, other items in keeping healthcare afloat in the state of New York.
While it is true the procurement of state funds can take time, the governor says she is not happy to see these funds not yet delivered nearly a year later.
I'm not satisfied. I want that money out. These providers need to have it. It was passed with the intention that they have it as soon as possible. So, no, I want that money out now.
And some state lawmakers share the governor's frustration.
It's important that the little bit of money that we provided last year in order to have these programs continue, get to providers. So I don't have unlimited patience for bureaucratic slowness. Government is supposed to work. People pay their taxes. They expect the government to work. They expect money reallocated to go out the door. There shouldn't be a lot of need to explain why it's taking so long.
You know, the appropriations that we allocate in the budget need to be funded promptly. Otherwise, we're going to see real problems, especially with Trump's cuts coming down the road.
Some lawmakers also stress this issue also impacts community health.
Here you're putting people's lives at risk when you can't get the money out the door, and it should concern everyone.
Democrats also aren't alone. Some Republicans also feel funding delays are unacceptable.
I don't understand. I mean, that to me, that's just additional government bureaucracy. It seems like regardless of my own personal belief as far as how much should be funded, I think that once it has been funded, I think that government works best when the money actually gets to where it's supposed to be going.
As a Republican, no, I'm not crazy about abortions. As long as reproductive health, I know that abortions are built into the state's constitution. We are an abortion state. So if we are going to be an abortion state, let's keep our women healthy by giving them whatever help that we can get them. Let's get this money to them so they can stay healthy.
Stark says they received the letter from the Department of Health and they continue to talk to lawmakers and leaders, hoping they get the state dollars from last year's budget soon.
And it is hard to sustain when we are providing services, knowing that funds are coming, but not knowing when, right? And so we have to sort of make do in the meantime.
Stark reiterates funding from the state for Planned Parenthood facilities means being able to keep facilities running. However, even then, it's not always enough. Planned Parenthood clinics and other reproductive health centers received about $25 million in funding from the state in 2022 for abortion services. Planned Parenthood of Greater New York, which currently operates 17 clinics in the state, was one of the facilities contracted to the funding from August 2023 to June of last year. However, they still struggled financially, having to close 5 clinics since 2024. Stark says she worries about navigating continued and increased financial obstacles.
We have made the hard decision to close some facilities over the past few years. We are trying very hard not to close anymore and to retain the footprint and the health centers that we have across the state now. That is critically important for care access, and we are working very hard every day, both from the public funds perspective as well as private fundraising to make that work.
Hegan stresses many facilities face many challenges when trying to keep their doors open, making state dollars that much more important.
Abortion services are constantly under attack. Abortion services are reimbursed at a much lower rate than many other services. And in order for us to continue to operate and be able to employ the high-quality professional staff that we have had to meet higher and higher cost of doing business with a lower and lower reimbursement rate.
Albany resident and Planned Parenthood advocate Cassandra Klawicki, who started going to Planned Parenthood when she was a teenager, says she has concerns about the state's funding issues.
I'm disappointed that the funding hasn't gotten out the door, but also I'm worried about the state being put in a position where they have to fill gaps that the federal government has just left wide open.
In this year's state budget, reproductive health advocates and providers are hoping to see about $55 million for abortion provider and medication services. Advocates and providers are also hoping to see lawmakers and the governor backfill Medicaid losses from federal rollbacks to Planned Parenthood.
We hope that the state will understand the essential role of those grant funds in ensuring that the populations across New York State and beyond continue to have access to care. As I said before, without access, our legal rights are hollow.
The governor's executive budget proposal allocated, as in previous years, about $25 million for the Reproductive Freedom and Equity Grant Fund, which ensures access to abortion. The governor's budget proposal also includes another $25 million for abortion providers and abortion medication reimbursement. State lawmakers increased the amount for these allocations. The Senate One House budget resolution included $35 million total for the Reproductive Freedom and Equity Grant Fund. The Assembly One House budget resolution included $30 million total for the Reproductive Freedom and Equity Grant Fund. Some state lawmakers say they want to see their increases in the final budget.
They're going to be cut. There's threats for even more draconian cuts to reproductive rights. So we have to pick that up at the state level, or we're not going to have those services.
I'm optimistic that we're going to be able, once we know how much money's on the table, to add to what we did last year and ensure that there's some reimbursement available for these services. Again, basic health care, women need it, women deserve it, and women are entitled to know they're protected under New York law.
While the final budget continues to be negotiated in overtime, some facilities are nervous that when the final budget is passed, they could see similar issues that they still face today with receiving funds from last year's budget.
We worry, and therefore we have to stay vigilant, and we have to get our supporters to be verbal, and we have to make sure that our lawmakers understand that, like, every day is another day that we're continuing to cobble together a way to keep our services going without proper reimbursement.
At a recent press conference, WMHT asked the state budget director why the public should feel confident in money from this year's budget getting out the door when they are still waiting for last year's dollars. Washington said this is an issue they intend to fix.
It's something we'll solve in this year's budget. We'll move with every bit of dispatch to get it going. And obviously, it's never great to hear that something's not implemented on time, but we're good for it and we'll make it happen.
The final state budget was due April 1st. It is currently nearly a month into overtime. Again, many state lawmakers and advocates are worried about the timeline of releasing funds from the state. However, some state lawmakers feel confident in the state dollars getting out the door soon and this year's process moving along quicker. We'll be following this year's state budget process along with the allocation of last year's state funds as it unfolds. Elise Klein, New York Now.
Next, we'll share a segment from WMHT's series Aging Together in New York. Our Vice President of Content and Engagement, Will Pedigo, conducted a town hall a few weeks ago to explore options for care at the end of life. New York has the lowest hospice utilization in the nation. And to start the conversation, attending physician at Saratoga Hospital, Dr. Newman Rashid, discussed what he sees in the ICU. Here's that story.
My name is Dr. Newman Rashid. I'm the intensive care unit doctor. I take care of the critically ill at Saratoga Hospital. When they're most sickest and most vulnerable, they're in the ICU for as long as they need. In the ICU, we have generally the rule of thirds. 1/3 are well coming into the ICU. They have a serious medical problem. Maybe they've had a major operation, and they go home without any deficits, and they go home to return to their normal quality of life, which is good. 1/3 come in critically ill. They'll receive treatment and they'll leave, but they'll leave with some long-term deficit. And 1/3 come in with multiple chronic medical issues, and they never leave because they pass here. That's the seriousness of the ICU. And those last 1/3 that are so sick that they have a long ICU stay filled with lots of interventions and painful procedures, they oftentimes don't receive long-term benefit from those interventions, and they pass painfully in the intensive care unit, unfortunately. This is the hardest time to talk about end-of-life care when you're already sick. The best thing to do for you and your family is to have these hard conversations when you're feeling reasonably well at home. The kinds of conversations you need to have with your family are what to do when I cannot speak for myself because I'm so sick. How long do I want to be on mechanical ventilation or chemicals to push my heart? Do I want CPR or not? What are my personal wishes regarding goals of care? For myself personally, at the end of my life, or when faced with a serious medical issue, having seen what I've seen, I would say it depends on the illness that you're faced with. If it's pneumonia, for example, it can be treated. You should take it all the way. You should treat it as aggressively as possible. But when you have advanced age, you have multiple competing comorbidities, having a goals of care conversation is very important to draw limits to how long you should be on a mechanical ventilator. I certainly would not personally want to be on life support for more than a few days. I think at the end of life, you want to be somewhere where you're comfortable, you're at home, you're not surrounded by strangers or loud machines, invasive, painful interventions. You want to be at home with your family, with your own comfort, and die with dignity.
Well, that does it for this edition of New York Now. Thank you for tuning in, and see you next week.
Funding for New York Now is provided by WNET,